Hello, I'm Dr. Lucas Shampoo from Vintage Veterinary Hospital. You can call me Dr. Luke because that's easier. Today we'll be discussing spaying and neutering of cats.
Dr. Luke, what is the difference between cat spaying and neutering?
So a cat spay is where we remove both ovaries and part of the uterus from a female cat, whereas a cat neuter or castration is where we remove the testicles. They are two different procedures. Cat neuters tend to be less invasive, generally a pretty quick and smooth process. Also quick and smooth for cat spays, but they are a little bit more invasive as we have to actually make an abdominal incision, remove both ovaries and part of the uterus. Generally though, whether it's a spay or neuter, they both do very well with few complications, and there are various benefits that we'll be discussing.
At what age should I have my cat spayed or neutered?
So the age of spaying and neutering does vary a little bit depending on the situation. In general, a good rule of thumb is about 6 months of age for a spay or a neuter. However, we do sometimes do that a little early, so 4 to 6 months is sometimes the recommendation that you will hear. In rescue situations or shelters, kittens are often spayed or neutered early, and that is because of population control. They want to ensure that they are getting fixed before they go out the door because we have lots of kittens around, and so by doing so, we're controlling the population. Some cats, if adopted older, or say they are found at an older age, they may be spayed or neutered older, and that's okay too, but ideally that 6-month time point is our recommendation.
What are the benefits of spaying or neutering my cat?
There are a lot of different benefits to spaying and neutering, both behavioral and health-wise. Health-wise, for female cats in particular, by spaying them at an early age, we are decreasing the risk for mammary cancer later in life. The other helpful thing is again, population control and preventing accidental mating. Sometimes those cats that are intact or not neutered or spayed are more prone to roaming as well, particularly if they have any outside access. And then when females are in heat, they do tend to show some signs such as increased affection, increased vocalization, and just some abnormal behaviors at home. So by spaying them, we are eliminating that. Male cats can be a little bit more prone to fighting when they are intact, and they also are more prone to urine marking, which is where they may go back up to things at home, such as boxes, walls, furniture, and actually spray a little bit of urine on there. And cat urine, especially intact cat urine, is powerful. So by addressing this early on, we are eliminating that concern.
Are there any risks associated with spaying or neutering?
Anytime we are doing surgery on any animal, there is technically inherent risk with anesthesia. However, generally these cats are, being that this is an elective procedure, are in generally good health. We take the necessary steps to mitigate that risk with our anesthesia. And again, generally the vast majority do very well with no complications. But there is always inherent risk with anesthesia for any animal. And that we don't always know how that's going to happen what's going to happen until we do it. But I would say by and large, all cats do very well.
What is the typical recovery time after spaying or neutering?
Typically, recovery time that you will see on our discharge instructions is 7 to 10 days. What we want during that time is trying to keep them calm. Now, as you can guess, trying to keep a cat calm and quiet can be a tough task. Sometimes they need to be confined to a smaller area of the house to accomplish that. We just don't want them doing anything too crazy, like really roughhousing, jumping a lot, anything that's just going to be too excessive after surgery. As you can imagine for yourself, there can be some complications that arise if they do too much too soon. Generally, after that 7 to 10 day time point, they're okay to get more free range, kind of get back to their normal life, but it doesn't hurt just to kind of ease them back into that transition. Usually there's no sutures that have to be removed in these scenarios, so it's just a matter of getting them to heal up.
What should I expect during my cat's post-surgery recovery?
During the post-surgery recovery, we do have some further recommendations that, again, we always send home on discharge instructions. Big things are, again, limiting their activity. We do like to have you watch for upset stomach afterwards. Sometimes doing a bland diet afterwards can help, or some small frequent meals. We have you watch the incision site closely and just kind of watch their behavior. We want to know about it if there's any vomiting, diarrhea, lethargy, decreased appetite, anything like that. It is normal for them to be a little sleepy the night of, but generally they come out of that by the next day and are acting pretty normal and pretty comfortable by then. They will be on a pain med for a few days afterwards as well.
How do I care for my cat's surgical site after spaying or neutering?
So we do not recommend bathing within those first couple days or within those first week or so after surgery. Most cats aren't going to tolerate a bath anyways. However, some spot cleaning can be done with either a damp rag or using some hydrogen peroxide on a rag to kind of dab around the incision. We just try to make sure we don't disturb the incision itself, whereas we're just cleaning gently around it as needed.
What should I do if I notice complications after my cat's surgery?
If there are any complications, like I said, we want to know about them immediately. And that can be anything from, not eating, to having difficulty getting pain meds, to, concerns for infection or irritation of the surgery site, and anything in between.
How does spaying and neutering impact my cat's weight?
So cats that are spayed and neutered do tend to have lower requirements for calories per day. It kind of decreases their metabolism, slows their metabolism, so we do sometimes have to adjust their feedings from there and just make sure we're feeding them an appropriate amount. Anytime that we are reducing food, we take it slowly, nothing drastic, and we can kind of walk you through that process. Generally, there is a suggested feeding amount on the food bag. However, that sometimes is an overestimate, especially for these cats that are spayed or neutered. So if anything, we may just decrease that a little bit, but we also kind of adjust it according to their lifestyle. So if they're particularly active, they may be able to eat a pretty normal amount still. I think that does it for our questions today. If you have any further questions or concerns, please give us a call. Our number is 402-489-0501. Thanks.